But when we're talking about policy issues, it's often true to say all policy issues are also personal. And when we talk about things like education and healthcare and taxes, we're really talking about policies that impact the types of opportunity in society that surround us and help steer us and decide where we can take our lives. But that's particularly vivid when we talk about this issue of opioid addiction. I think everybody's kind of used to seeing the statistics you see in the media and the staggering impact this has had on our nation, on our economy, our healthcare system. But it's really important for us not to lose sight that behind those numbers are people. Each person is a story. They're a story like Erica's and like Jessica's story of people whose lives are forever altered by the impact of opioid addiction. And many of these stories, like Erica's and Jessica's, can give us encouragement. We know that society has the opportunity to help reverse these numbers, and in doing so, help people live and their loved ones live better lives. So today we're going to be talking about some of the work that's being done to address the opioid crisis, both in helping people recover from addiction and from preventing addiction in the first place. And then I hope that everybody in this room, myself included, can get better informed about how we can help in this process. And our two speakers today are really playing a leading role in this battle, and I'm so pleased that they're both able to be here with us today. Now I'm going to introduce them both first. Charmaine Yoest is going to be our first speaker. She is the Associate Director of the Office of National Drug Control Policy at the White House, and she's leading the response on the opioid crisis. Charmaine was previously at the Department of Health and Human Services and served as President of United for Life, and was also the Project Director of Family, Gender, and Tenure Project at the University of Virginia. Charmaine is a PhD in politics from UVA and has 5 children. So Charmaine, thank you so much. And then we're going to be hearing from Jessica Hulsey Nickel, who is the founder and president and CEO of the Addiction Policy Forum. The Addiction Policy Forum is a national nonprofit organization that brings together a lot of the players in the opioid field and raises awareness about addiction and helps implement comprehensive responses that include prevention, treatment, recovery, and criminal justice reform. Now, Jessica comes to this issue from personal experience. Her parents had struggled with heroin addiction, which profoundly affected her upbringing. And in spite of facing homelessness and spending time in foster care, Jessica flourished and began her role as an activist at just age 15. She graduated from Princeton University and today is a parent to 3 boys. And it's funny because when I first met Jessica, I started listening to her, and I was there with my hat on as the president of Independent Women's Forum and thinking about this as a policy issue. But as soon as I started hearing her speak, I started listening to her as a parent. My oldest daughter is just turned 13, and I thought, wow, I need to get better informed about this. And I thought this is information that all of us really need to hear. So I'm really pleased that both of you are here today. And Charmaine, I'd love to hear from you first. Thank you.
Carrie, thank you so much. I think that you know how special it is for me to be here at Independent Women's Forum. I go back in friendship with many of you in this room a very long way. And thank you so much, Erica, too, for your bravery in writing the book and helping to move this dialogue forward. So speaking of my long relationship with Independent Women's Forum, if you guys will humor me, I want to just make a quick aside and a tribute before I start. This morning I opened up social media and there's still a lot of September 11 things in my newsfeed. And I saw a video that I had not ever seen before over the last 17 years. Someone had put together a compilation of the audio that ran through that day, and it really took me back to the events of that day. And I'm glad that I saw it this morning because it reminded me that it's really kind of a remarkable coincidence that we're having this event on September 12th. Many of you may be too young to remember Barbour Olsen, who was a friend to so many of us in this room and who was intimately associated with Independent Women's Forum. But the hardest thing for me on September 11th was when her face flashed up on the television. I didn't know Barbour that well, but I did know her through Independent Women's Forum. And that's why I felt like it was a good, taking a moment to remember her legacy and her deep investment in public policy and her investment in the sense of being a woman and bringing that female perspective into public policy, That's what we're here to talk about today. And so I did just want to, I feel like that's a really good frame as we talk about an issue that particularly needs Independent Women's Forum, and it particularly needs the women in this room. So thank you, Carrie, for having the leadership to put this group together. So my very first day in this job at the Office of National Drug Control Policy at the White House was the President's Opioid Summit in the East Room of the White House. And so I'm sitting there, it's my brand new job. You all know the East Room, it's so imposing. And you have George and Martha Washington looking down on this entire room full of people. You gaze out onto the lawn of the White House. So, you know, you can't help but be excited about being there because it's such an imposing environment. But story after story unfolded of parents who had lost their children to the opioid crisis. And toward the end of the day, one father stood to tell his story, and he said, "I never imagined I'd be here at the White House, but I'd give all of this for just another moment with my son." That particular comment that he made, you know, of everything that I heard that day stuck with me and has kind of been a linchpin for the work that I'm privileged to do at the White House on the opioid crisis. Just remembering I'd give all of this for just another moment with my son. All of us as parents, we instantly resonate with that. No parent should have to write an obituary for their child, but working on this issue, we see them very regularly. And I think another reason this is a very timely event is the cost that we're paying for this crisis is in the headlines this week as the music community is mourning the loss of Mac Miller, the rapper, who was only 26 years old when he overdosed this past week. I have 2 teenagers at home, and so this role of musical artists, of being role models to our young people, really comes home to me because the first that I knew of this happening was a text from my 15-year-old. I'd never, frankly, heard of Mac Miller before. I'm not exactly his target audience, right? But my 15-year-old was, distraught. "Mom, Mac Miller has died." And I instantly thought, oh, shoot, is it going to be an overdose? And of course it was. And this follows on the heels of Demi Lovato's overdose. Thank God that she was able to get help in time and to go through a stay in the hospitalization. We're all cheering for her as she goes into recovery, and it's particularly appropriate and a little unusual that it is Recovery Month that we're celebrating this month. Having a national conversation, trying to get people to look at and invest in and to think more deeply about how we can invest more in recovery. So as we are mobilizing the White House response, we have a website called The Crisis Next Door, and we're referring to it that way because we want people to think about the fact that this crisis is particularly unique in the way that it does not discriminate. It doesn't matter whether you're a male or female, rich or poor, inner city or the suburbs or rural areas. Everybody's being hit by this. It's an equal opportunity attack on the American people. And I'm particularly glad and looking forward to hearing Jessica's presentation today, because even though we're focused on opioids today, I would like to underscore that this is not just an opioids crisis, it is an addiction crisis. It's an addiction crisis. And it's critical that we talk about how we prevent drug abuse of all kinds. I have a map in my office of where some of the programs that we administer at ONDCP are located, and it's overlaid with the death statistics from the opioid crisis. And there's kind of a swath in the middle of the country that doesn't look too bad. And so I was talking with some of our experts about that, and they said, "Charmaine, don't get too distracted by that, because where you're not seeing the opioid crisis, that's where you're seeing the meth crisis." So, and frankly, when we're talking to people on Capitol Hill, depending on which offices we're talking to, they'll say, "Hey, we're really glad that you're pursuing the opioid crisis, but please remember my constituents are confronted with meth." And then, of course, I believe that we are making progress in terms of people knowing what fentanyl is, but I would be remiss if I didn't mention the fact that one of the reasons we're seeing such an escalation in the death toll of opioids in particular is the fact that the drug traffickers are now working fentanyl, which is a very highly potent synthetic opioid, into the drug supply. I was talking with someone, I said, from a market perspective, this doesn't make sense. Why do you want to kill your customers? And of course they don't want to necessarily kill their customers, but it is such a potent drug and it hooks people almost instantly. It has a medical use, obviously, but in these street drugs, it's highly effective at creating new customers for drug traffickers. But it is so powerful that it is driving the increase in the death rate. And of course, to make this whole situation more complicated, in many cases, opioid misuse does start with a prescription from your doctor after injury or surgery. After 10 days of use, the likelihood that you'll continue using opioids for the next year rises dramatically. So we need to be working on getting out the information about appropriate use of opioids under a doctor's supervision. And Carrie mentioned something that's very close to my heart, or maybe it was Erica, but either one of you. One particular consequence of the opioid crisis is the growing number of children with parents who've been affected by opioid abuse. In 2016, there were 437,000 children in foster care specifically because of parental substance use. 49,000 of those children who entered care that year were under the age of 1. And that kind of directs our attention to another whole element of this crisis, which I'm hoping you've already heard of, the neonatal abstinence syndrome, which refers to babies who are born having been exposed to their mother's opioid use in the womb. Let's be really clear, they're not born addicted. Many people think that, but they do have to go through withdrawal once they're no longer exposed to the drug. And that's a very difficult process for them. From 2000 to 2012, the number of babies born exposed to opioids increased by 383%. So I'd like to transition before I talk a little bit about what we as a community in this room can do to address the crisis. I'd like to talk about how within the administration we're addressing this. I hope you've already heard a little bit about the initiative that the President announced in March called the Initiative to Stop Opioid Abuse and Reduce Drug Supply and Demand. The President has been really clear and emphatic that he expects this to be a whole of government approach and that every cabinet secretary is to be addressing this issue in a coordinated way. One of the things that's exciting about being at ONDCP is our role is to provide a coordinating function. When you have a social issue, a crisis like this that is knit into the fabric, that brings together so many different elements of public health, but also public safety and issues in the workplace, you've got to bring all kinds of different elements to bear on the crisis. And so that's the role of ONDCP. But so in the President's initiative, there's 3 different elements to it that all need to be knit together. The first is working to reduce demand. This is the prevention side of things. We do have what we refer to as the information underload. A lot of kids out there just don't know the threat from fentanyl being woven into things like Xanax and other street drugs. They have to learn that you cannot take opioids out of your grandmother's medicine cabinet and use them in a way that is safe. That's not a safe approach. And so that kind of information needs to be getting to young people and frankly even older people. That's why ONDCP launched a media campaign at the beginning of the summer. I'd really appreciate it if you'd go check it out. We partnered with the Truth Campaign and the Ad Council to develop these ads, and then we will, in the coming days, have another iteration of the ads coming out. But these ones were organized around the theme, Know the Truth and Spread the Truth, and you can find them at the website opioids.thetruth.com. Or you can go to ONDCPU's website and find a link to get there. But opioids.thetruth.com. One of the reasons I mentioned you going out and looking for them, one of the tools that we're using that is an exciting opportunity is modern technology. It's kind of interesting to me to see how effective the micro-targeting is that you can do with online advertising. Going back to my 15-year-old again, obviously he's the target market. And on the day that we launched the ads, I had still not seen them anywhere because I'm not the target market necessarily. My 15-year-old texted me, he's like, Mom, did you see these great new ads that just launched? And he goes, did you know that you can really quickly become addicted to opioids? I'm like, yes, James, I did know that. But please do take a minute to look up the ads, and when we launch the next series, please partner with us in making sure that we're spreading the truth and getting that message out to the people who need to see it. And then the second element is this obviously cutting the supply. We've got China sending fentanyl through the mail over our borders. You've got Mexico, Colombia, different, we've got to find ways to cut the supply through working through interdiction. We're very proud of the work that the FDA and the Department of Justice is doing. They're working to crack down on illegal online pharmacies and the promotion of these kinds of things on the dark web. I don't know how familiar you are with the dark web, but it's just like eBay. On there you can, kids can go on and order drugs and it gets delivered right to their house. So part of the challenge that we're facing is that we have both a 20th century drug crisis and a 21st century drug crisis operating hand in hand. Your old drug crisis was drugs coming across the, just the actual drugs coming across the border that we needed to interdict. Now you've got the synthetics that are not grown in the field but made in a lab coming across the mail. So we're working on ways to tackle both of those simultaneously. And then third and finally, the President is truly committed to supporting treatment and helping to move people into effective recovery. And because we are celebrating Recovery Month, this month in September, we are particularly wanting to emphasize that recovery does work, that there are pathways to finding ways to address addiction. In March, the President signed legislation appropriating $4 billion to address this crisis. And actually, another reason this is a great thing to be addressing today is hopefully the Senate is going to vote tonight, depending on this weather, of course. But there's an opioid package moving its way through the Senate that we are expecting a positive outcome in getting that passed tonight, and then a reconciliation with the version passed in the House and the President being able to sign it. So we're looking forward to that. And then I mentioned the fact that ONDCP has some grant programs that we administer. We have two of them. One is DrugFree Communities and the other is high-intensity drug trafficking. The DrugFree Communities are focused on prevention at the ground level, and the high-intensity drug trafficking is focused on interdicting the supply. But just this last week, we had a very exciting event in the Roosevelt Room in the West Wing with the President himself, and he announced an unprecedented record $91 million in new funding for 731 drug-free communities. We like to emphasize that the drug crisis in particular is a local problem. In a local problem like this, you need local solutions. And that's what the drug-free communities are designed to address. In order to get one of these grants, there's 12 different factors in a community that you have to demonstrate that you're pulling together in a coalition effort to make a difference. Schools, churches, law enforcement, all of these different elements need to be brought together because it is a multifaceted problem. We have to develop multifaceted solutions. There's 60 million Americans who live in a community with a drug-free grant coalition. If this is something that interests you, I hope you'll look into it because every state in America has a drug-free coalition that you can become involved in. And then I'd like to wind up before turning it over to Jessica by talking just a little bit about how I see groups like Independent Women's Forum and how important the community is in this fight. So in the 1830s, one of my favorite political theorists, Alexis de Tocqueville, came over from France and traveled America. And how many of you guys are Democracy in America fans? Mine is kind of worn. I had to write a whole lot of essays about it because I was a political science major, right? So he, as a Frenchman coming to America and traveling around the country, when he wrote Democracy in America, it was all about, from a European's perspective, what was unique about Americans? What was different about this brand new democracy that was being born? And what he wrote was that Americans are really unusual in our connection to civic associations, that we like to form groups, and we like to do this in order to tackle problems. And I wanted to mention that because it's particularly relevant to the drug crisis. Forming groups at the local level is particularly important for health issues. And as a women's group, I wanted to tie this together with the Maternal Lists movement at the turn of the century. If Tocqueville talked about civic associations, the Maternal Lists, which were groups of women who were animated by the social concerns of their day, they put together something that they called civic housekeeping. And they're the ones who are responsible for the child labor laws. They're responsible for creating public collection of garbage in order to address the health issues that we saw at the day, because we at that time didn't have public collection of garbage. So today, I would like to say to Independent Women's Forum, as the women of today, we have a challenge in front of us to address that is unprecedented. The president declared this almost a year ago, a national public health emergency, and we must mobilize at the local level and at the civic association level to make a difference. And one of the things that I really want to emphasize with you, Carrie was mentioning, we're having a casual conversation before we got started. One of the things that she mentioned factors directly into what I wanted to communicate to you is that parents today, this is a very different world that our kids are growing up in than the one that we grew up in. They're facing different challenges. These, ordering fentanyl over the internet and having it come to your front door, that wasn't something that my parents had to worry about, right? These are very different challenges for us as parents. But here's what, that can be terrifying. But here's the positive and encouraging message that I want to give to you. I have some phenomenal colleagues that I'm so excited and energized about working with, and some of them are over at the National Institutes of Health, NIH, right up the road. And there's an institute there called the National Institute on Drug Abuse, and they're doing a lot of research into addiction and how it works and how you interact and how do we do prevention and recovery with people who are struggling with addiction. And what NIDA has found in their research, it's actually a longer research, and I can share this publication with you if you're interested, but I wanted to pull up two things. One is the importance of family, and secondly, the importance of community. This seems like common sense, but sometimes we need to come back to common sense and realize that it does make a difference having family that surrounds and encourages and supports young people. As parents, be encouraged that setting boundaries for your children, it's not just common sense, but science has demonstrated that this is one of the strongest protective factors for children. One of the strongest protective factors for children is parents being involved in their life, setting boundaries, and maintaining the standard that you don't use drugs. It's deeply, deeply important. And of course, we recognize that not every child has the benefit and the advantage of having parents that are involved in their lives. We started with talking about the kids in foster care, right, whose parents are already caught in the grips of addiction. That's where community comes in. Second element of prevention, absolutely essential, are strong bonds to communities. Kids who feel connected to their communities, that's a protective factor around them. Obviously, it's not always going to work, but this is a protective factor that we can emphasize. And I'll quote from the research. It said strong bonds with institutions such as educational and religious institutions. Educational and religious institutions, but then also, things like YMCA, any kind of, going back to Tocqueville, civic association that we can think of. This is a way to reach out to kids and to build walls around them. So it's good for us to be reminded of this common sense and to come back to things that we know we can do. This is effective, and it's a way for you to channel your activism. Get involved in your community's AntiDrug Coalition. These elements work. The DrugFree Communities have really, really impressive data on the schools that they're involved and how much they're able to keep kids from being involved in drugs. So if you have children, be involved with your own children. If you don't, get involved in your local communities and provide help for kids who need it. And then finally, to conclude, this is a tribute to you, Erica, and others in the room. If someone in your family has struggled with addiction, it's really courageous to speak out about it and to share your experience and what that looked like and how you were able to succeed. President Trump talks about the loss of his brother to addiction. Other people that we work with in recovery, Jessica, and I had a fantastic meeting with some of the parents in Jessica's organization. Really, really heartbreaking to hear the stories of loss that they've gone through. That takes so much courage. Jim Carroll, who's the president's nominee for Drug Czar, this was a meeting that we had, and after hearing from some of these parents, he invited them to come over and meet with the people that we have working in interdiction, put them together and said, hey, let's talk about how we put these different elements together. So we can do that in our personal lives and organizationally through Independent Women's Forum too, to find ways to put prevention, treatment and recovery, and attacking the supply all together in one movement that has dynamism and momentum moving forward. Because working together, we can save lives, strengthen our communities, and safeguard our country. Thank you all so much for being here today.
Hi everyone, I'm Jessica Hulsey, and I'm the founder of the Addiction Policy Forum, and I am so grateful to Carrie and others for having me here today. I am the youngest person in the field, or the youngest, well, I don't know which way it goes, but I have been doing this work for 27 years. I got started because I had a fire in my belly, even as a youngster, to try to help other families that were struggling with addiction. And I knew and was so very aware of all the devastation and heartbreak that substance use disorders was causing in my family from a young age. So much so that though I officially got started in a DrugFree Communities coalition, actually in Southern California, when I was 15, I think my first day on the job was in kindergarten. On my very first show and tell, and I was living with my grandma at the time because my mom had been incarcerated. She was in prison as a result of her heroin use disorder. So it's my first show and tell, and I go in and I talk to Mrs. Dean, and I'm like, I'm going to talk about heroin and how bad it is for you. And if your mom is using it or your dad, these are the things that you should say and reach out to get your parent help. And she very lovingly said, well, Jessica, maybe we should change the content of this just a little tiny bit. And I ended up talking about medicines, good medicines, bad medicines, why you should not take medicines that are not yours, how you should love people that are taking them, even if it's hurting them. So a long time that I've been in this field. Both my parents struggled with heroin use disorder, which for me and my little sister meant homelessness and living in cars and hunger and foster care for a time until we were placed with our maternal grandparents. My mom and dad were in and out of prison and jail. My mom found recovery through a drug court judge before there was actually drug courts, who gave her the option of finding treatment and support and a pathway to health and wellness instead of that cycle that she was caught up in. My father unfortunately did not find that pathway. He progressed from heroin use disorder to crack cocaine use disorder. I was able to find him at the end. He died from the health consequences of being on the streets for 20 years. But at least we were there for him in the end. My mom unfortunately died at the age of 50 because from a heart attack. Because there are long-term health consequences to having a substance use disorder that goes beyond even our overdose deaths. So we need to make sure that we follow a healthcare model as we address addiction, because so much of what we've done has been built outside of healthcare. So I want to go through a little bit and not get into, we could talk about integration into the healthcare system or changing how our criminal justice system responds, but really what I wanted to dig into today was prevention. This is an entirely preventable and treatable disease. We don't have that. You can't prevent all forms of cancer. You can't prevent all forms of diabetes. We can completely prevent substance use disorders. We have the science, we have the programs, we have the tools and the mechanisms all in our toolbox. But we have yet to take them to scale and implement all the things that we know when it comes to prevention in a single community in this country. So I want to chat a little bit about that and then give a little pep talk for all the parents. Can I have a show of hands for parents in the room? All right, there's quite a few of us. As Carrie mentioned, I have 3 sons. They're 14, 13, and 10. They're also my primary focus group for all things that are adolescent-based. So that's amazing. So a little bit about Addiction Policy Forum. We are not even 4 years old yet. I started this organization for a couple reasons. One, I was pretty frustrated that we family members were kind of always the tokens, right? I was like the one kid or young person that was invited to be at a conference or congressional hearing or an event that had an impact. We were sort of a little bit marginalized. We also have been the only disease in America that has never had a patient advocacy group. Like, not only is it American Cancer Society, American Diabetes Association, Alzheimer's, Autism Speaks, you name it. Even the rare diseases had patient advocacy groups and a research agenda and raise money. There's 5Ks and 100-mile, bike rides and all these things to look for a cure, to drive discovery, to bring patients together, to be better informed. So we just decided to build one ourselves. We work really closely with NIH, with the National Institute on Drug Abuse, to translate the science around this illness, but to turn it into little tiny snack-sized packs for the regular folks among us that don't understand neuroscience and the details of a brain disease. We also use our voices. We have worked really hard on that Senate Opioid Package and the House Opioid Package, H.R. 6, has more than $3 billion in new resources and much better policies. And we have come together in, I think, in a pretty formidable way, pretty quickly. We have 4 million families and patients nationwide. That's our reach. We have 39 chapters up and running and plan to be in all 50 by the end of the year. And we use a lot of our families and our volunteers. We've lost people that we love. I've lost a total of 6 people in my family to addiction. I can't bring them back. I would give pretty much anything to even have one more day with my mom. But I can use that grief as my rocket full of fuel and fire in my belly to do good things for other families, so we can help all those that are hurting as a result of this disease. So our basic mission is very simple. We envision a world where fewer lives are lost and help exists for the millions of people impacted by this addiction. 21 million Americans today who have a substance use disorder. 15 million of those 21 million are struggling with alcohol use disorder. Our primary drug of misuse and addiction is alcohol in this country. There are more risks for overdose death because of opioids, but we're seeing increases in crack cocaine and cocaine, methamphetamines. We need to focus on all addiction, on substance use disorders. We also need to come together. Having almost 30 years in this field, we sometimes get focused on the shiny new thing, right? It's the new area or the new lane or the field. But the reality is it's technically called a disorder in the DSM-5 among our psychiatrists and physicians because it's complicated, right? It's a disease, but it is complicated. It's complicated how you contract it in the first place and how you develop a substance use disorder and how you treat it. And it's complicated and comprehensive, and all the players that we need to have at the table to fix it. It needs to be our parents and our educators, law enforcement, folks doing interdiction work on the supply side, healthcare providers, treatment, recovery support. We're all on the same team, and this foundation is stronger by us coming together. So a little on the prevention side. I think that we need to focus more attention on this prevention piece. It is so incredibly important. We can prevent this illness. This is a pediatric brain disorder, right? This is an adolescent issue. 90% of those that have an addiction today developed this and started using substances before the age of 17. Unfortunately, we have set up a treatment system for adults. So just let that sink in for a second. This is the only disease in America where we wait for it to worsen before we address it. That would be like waiting for your first amputation before we'll treat your type 2 diabetes, right? So we know that this begins in adolescence, a lot because of how the adolescent brain works. The other thing that we've learned is that substance use, is less about preventing drug use altogether. There might be medicines that are going to be used. You might need an opioid at some point in your time. You might need a benzodiazepine. You might drink alcohol. You might smoke something. but it is the age at which you begin these behaviors that have the biggest impact on your likelihood of developing an addiction. Adolescent brains are amazing. They're sort of these supercomputers and plastic and fast growing, and they can learn things more easily, like a musical instrument or a language. I don't know about you all, but I can't learn a new language to save myself at 42. But my kids seem to pick it up like gangbusters. And that is because of the mechanisms and the growth rates and the learning rates that they have in their brains. So when we talk about, for example, the drinking age of 21, have you ever sort of had one of those conversations with a young person that's challenging that? Oh, this is arbitrary. You can go to war, but you can't drink. You can vote, but you can't drink alcohol. From a neuroscience perspective, that's actually too young, right? Girl brains grow up at 22 years old, and boy brains at 25. Insert chuckle, right? We knew that there might be some differences there. And when you start to introduce things like alcohol into your brain, it needs to be pushed back until an age at which your brain is able to withstand that. Particularly if you say, like me, have a genetic predisposition. I have 4 generations of addiction before me. That means that I need to be more careful, let's say the next person or my neighbor who does not have a genetic predisposition. So prevention is about delaying the onset. In our adolescents, they use 3 things primarily to get started. They use alcohol, marijuana, and tobacco. And the age at which you begin these things can create a sensitivity to addiction. We kind of disproved gateway theory, but we proved something more scary, that the age at which you begin using these things can create a sensitivity to addiction for the rest of your life. Right? We also know that on the teen sort of, you're completely right, this is a very different scenario that we're in. There's just so much more risks for our kids, so that's why I think we need to be better informed as moms and dads. Things like, has anyone ever heard of a salad party? This is not like a healthy, like non-carb choice of a party event. This is when teenagers or adolescents or college kids each bring a selection of prescription medications from their home medicine cabinet, not knowing what it is, and you throw it into a big bowl, you mix it up, it's colorful like salad. It's not tomatoes and lettuce, it's a combination of things. And then people take big handfuls, party goers, and there can be really, really devastating consequences. When we have trends like this there's also, I don't remember what it's called, but something really risky that the kids are using, that's a bunch of codeine-based cough syrups with gummy bears and Sprite and other things that actually can cause an overdose and death immediately when you use this concoction. So we need to make sure that we are taking the information of how to prevent substance use disorder to our parents. A little bit, this is my driving home. I'm going to make sure everyone in this room leaves knowing that kid brains and grown-up brains are not the same thing, right? So when I talk about this amazing, fast-growing adolescent or child brain, you can learn things more easily, but you can also harm it more easily, right? So we have a job as parents, as policymakers, as a community, to make sure that we take the science of the neuroscience of this issue and make sure we understand how that translates to our own homes and family and breakfast tables. So when you're like 5, 10, 17, your brain is like this rainbow. Green and yellow and orange and some red spots. This is like this fast growing. The neurons are firing more quickly. You can learn things. You can also be harmed much more easily. You get to be our age, most of us I think, at least mine, and we have blue, boring brains. Things aren't learning or moving quite as fast, right? So we need to teach parents that while this brain is in development until early to mid-20s, our job is to protect those brains, to make sure that we do not implant a substance use disorder and addiction in our kids that will shackle them for the rest of their lives. This is a chronic illness. So how do we do that? So I'm gonna go over a couple of these things, some little examples, and when we sit down we can answer some questions. Talk early and often. If you ever run into Tyler Kelly Nickel, my 10-year-old, and ask him about neuroscience and addiction, he's gonna sit down and have a conversation with you, because this is a pretty common topic at our dinner table or in my carpool lines, because I really feel like most talking happens when I am chauffeuring my children around all over the place. Talk early and often. These are very different conversations. It can be age appropriate, from don't take medicines that don't belong to you, about have never let my kids pretend to drink or smoke with things, because that is pretending to do something harmful for your body. That's a 5 or 7-year-old appropriate conversation. When I have a 10-year-old, a little bit different. Talk early and often. The science is very clear that bringing up this topic does not mean that your kids are going to do it, or it's going to minimize risk or encourage them. Talk early and often. And what are you talking about? Setting clear expectations for no use. Parents are the #1 powerful thing in a child or adolescent's life, to create some very clear expectations. And we need to make sure that for our larger community, we are clear what that expectation is. Abstinence, no use whatsoever, is preferred. If they bring up the 21-year-old alcohol thing, it's like, your brain is not built to handle alcohol and drug use, particularly while you're fast growing. My oldest, who's 14, his way of interpreting this and then spitting it back to me, he's like, Mom, I get it, honestly. Are we doing this again? I get it, Mom. You have a force field around your brain. This is our Star Wars metaphor. You have a force field around your brain because it's an adult brain. My force field is still in development. So I'm going to wait to do things like drink until my force field is fully built. The other thing that we have to do is have very clear boundaries and consequences, right? Carrie and I have spoken about this a few times, and we also have to dispel very harmful myths, and I find this everywhere I go. I live here in Montgomery County, huge problem with parent-provided alcohol parties. We need to dispel the myth that this is a rite of passage and it's safer if they do it at home. I am sorry, but if you are a parent worried about BPA stuff and plastics and red dyes and foods and organic, you should not be providing alcohol or other substances to your child who has a rapidly developing and more vulnerable brain. We need to make sure that we transmit this information. It's like in this drunk driving sort of frenzy that we focused on. We think that people and our adolescents drinking at home is how we keep them safe. It is missing one whole very, very important aspect of this issue, is we want to keep them safe from developing an addiction. And for those that have parents that provide alcohol and make this accessible, we find higher rates of binge drinking and higher rates of addiction. When you begin drinking in adolescence or using drugs, you have a 1 in 4 chance of developing a substance use disorder. If you wait till after the age of 25 and your brain is developed, you have a 1 in 25 chance of developing a substance use disorder. Right? So how do we make sure we transmit this information? Pay attention, don't avoid the topic. The other thing, I didn't put this in here, I don't know about all of you, but have you ever said yes to something that you really shouldn't have said yes to? Like I don't know, being PTA president when you're really busy and traveling all over the country, or another committee that you're on or something, or signing up for whatever it might be. We are sort of programmed as people pleasers to say yes. Well, if you're going to ask your children or adolescents to say no, teach them how to do it. So I have role playing. I'm like, so what's your question to this? This also applies about when my middle son gets asked out by girls. We've got some answers ready for him, so I don't have to help him break up with females late at night, which has happened a couple times. And he's like, sure. He's like, oh my gosh, I think I have 3 girlfriends today. But anyways, so we talk about this. What are you going to say as a response to this? Hey, that's not for me, but you have at it. Or, hey, my mom is crazy and she's going to drug test me, so that is not going to be. Or, I'm really serious about lacrosse and that's not healthy for me, so I'm going to pass. Make sure that you have conversations that are just not at the surface, and that you are giving your skills to your teenagers so they know how to combat this and how to respond appropriately in social situations. And the other thing that we already touched upon is keeping your teens involved. I do not care about what your teenagers' resumes look like for college admission that are 19 pages long and have laundry lists of organizations and volunteer work, etc. No, the purpose of that, the purpose of engagement and involvement is not to sort of rubber stamp activity and move on. Attachment and pro-social engagement are the 2 fancy words that are 2 of the most important protective factors on the individual stage for our kids. And that means the feeling of belonging to something that is healthy to you. So it is not sort of a check off, not really engaged. It's actually getting involved, whether it is band, or Model UN, or lacrosse, or cross country, or your church activity, or 4-H, or Future Farmers of America. I don't actually care what it is, but I care that we make sure that parents know that this is not the need to pressure for a long laundry list of accomplishments and feeling of overachievement. It's that they are involved in something that is positive for them, that gives them a sense of community and belonging to something that is healthy. And the other part of that is that that's the attachment, that's the belonging part. And the pro-social engagement is being engaged, right? They need to be actively engaged in things that are healthy for them. My sister was born with neonatal abstinence syndrome, right? And she struggled for a number of years and is in recovery now. For this January will be 13 years, which is really exciting for her. But one of the key components when you look at how different our lives were is that attachment and pro-social engagement, I hit that out of the park. I had lots of I didn't drink till I turned 21 because I have a more risky brain than others. So I just hung out with all the Mormons on the weekends because they did all this non-drinking stuff, even though I was an Episcopalian. I did cross country and the school newspaper and my DrugFree Communities Coalition and activities that were in the drug prevention field. But make sure that this is not about a resume building. This is about making sure our adolescents are engaged and have a feeling of belonging to the things that are healthy for them. So that is a really quick recap. We're coming out with a video next month that sort of in a much more cooler way sort of lays out some of the things that our parents can do with some toolkits. But there's a role for every single person in our whole country and everyone in this room. There's comprehensive responses needed, so whether it's healthcare or policymakers or employers. Employers are such an important role for an early intervention piece to make sure that we're giving care to our employees. To those in healthcare, we need to change how we treat this illness. When you get diagnosed with breast cancer, you don't think, oh my gosh, I hope I can find a cancer bed in Arizona and liquidate my 401k account quick enough, right? So we need to make sure that we find the quality treatments providers and the physicians and the healthcare responses to treat and prevent this illness and to intervene as early as possible. So that's it for my recap. Again, if you want to get involved in our chapters or take our course on the brain and addiction, or even our 4-minute video version, see me after and we'll get you signed up. And thanks so much for having me here today.
We're ready to take some questions from the audience. So if anybody has anything, otherwise, okay, great. Why don't you go ahead? Did you want to take this, Ashley? Sorry. Yeah, I know.
Good morning, distinguished panel and beautiful women in the room. My name is Darla Carney, founder of Speak Life. Yes, we all stand and agree in this room today that opioids is a major problem in our communities and in our families. I have a 10-year-old daughter by the name of Zoe who suffers from frontal lobe epilepsy. Ever since she was 6 months old, she would have up to 60 seizures a day. She was softly introduced to barbiturates and opioids by the age of 8 months. So 3 times a day, I'm giving my baby clonazepam, diazepam, so many drugs, and was unaware of the effect that it had on her young brain. Not only that, the seizures never stopped. So year by year, she was constantly introduced to different types of opioids. And at the age of 8, they decided, hey, let's just try to give her brain surgery. There is no recourse behind it. There is no science that can really tell us why she's having these seizures, but we would like to just take a look in her brain. At that time, I declined on that. And I did a lot of research on medicinal cannabis. In this room, I don't mean to offend anyone here, because you did speak about marijuana being one of the things introduced to children at a young age and the effects that it can have on them. But my daughter went from having 60 seizures a day after major research that I did to being 91% seizure free. So I say that to say that even though the opioid epidemic is sweeping the nation and people are getting punished for popping pills, for taking methamphetamines, all of these things, people are getting punished for that. But I feel that if this epidemic is sweeping our nation like that, we need to go to the main culprit, the cause, which is big CEO pharmas, and hold them accountable for the 91 people that die every day. Hold them accountable for negligent homicide, and that's how I visual it. So just in saying, there is hope in medicinal cannabis. There is power in medicinal parents. Parents are getting their children snatched away daily because they're trying to do an alternative way to medicate their children outside of the opioids and benzos. Imagine a 6-year-old child that wants to commit suicide because she doesn't like the way her face looks. That's the residue of those opioids. So I feel if my child feels that way, I feel if the cancer patient that wants to have a secondary option of medicating with a cookie that is infused with cannabis opposed to an opioid that makes them sleep all day, they should have that option without being, legally backlashed. So there is power in medicinal cannabis, and I'm standing firm here to say today, I suggest you all look at that as your secondary option, or speaking life, or that being your secondary option opposed to opioids.
Thanks. Thank you for sharing your story. And I think what this kind of speaks to is that there is one of the things that's complicated about this is when it comes to something like marijuana, which obviously I think there's a growing recognition that there can be appropriate uses, and this can be used to help you alleviate suffering and to treat certain types of illnesses, just as there are some truly positive uses there's a role for opioids to play in extreme pain relief, which is something that I think frankly makes it harder, because in some ways, while recreational abstinence, just say no makes sense as an entire community, just say no is not sufficient, because we do want people to have pain relief when we have it. So do you have any thoughts or guidance on making sure that we have a role to say yes when it's necessary for something like whether it's marijuana or opioids when properly used versus preventing the bad uses?
Just talking about the science, what the research indicates to us, there have been some studies that show that CBD components of cannabis can have a medical purpose. And that means that doesn't have THC, which has the components on the brain that is going to cause addiction. You can become addicted to marijuana. There is marijuana use disorder, and this can be complicated. So the reality is, marijuana is complicated. There can be medical uses, and we need to make sure that we aren't just sort of broad swiping, smoke what you want. We don't smoke anything else that we take for medications, so we need to also make sure that this is integrated into our healthcare system. There are components of CBD that can treat epilepsy or autism or help with cancer treatment symptoms. We need to make sure that we give the resources and the policy changes to our research and medical community to figure out what those proper uses are to help our kids and our family members and our patients that need access to anything like that. At the same time, we need to not ignore the very, very substantial evidence that marijuana usage, recreational usage among adolescent populations can have a really negative impact on the brain, particularly if you have a sensitivity or mental illness in your family. So this is about being thoughtful, and I feel so often we've been very knee-jerk in this field, that it's like, oh, I'm the I hate marijuana crew, or I'm in the oh, I love this and everything needs to be legalized. The reality is that we need to push our pause buttons. This is what I talk about in my house, my pause button, being mindful, and make sure that we're working with our research and medical community on the CBD components and the research and the more R&D that's needed there. At the same time, not closing our eyes to the research around how marijuana can be a risk for our adolescents as we move forward. So I applaud you for being here and sharing your story and being such an advocate for your child. I agree that we need to make sure that we're being thoughtful with our research agenda, but let's also be thoughtful and mindful to make sure there aren't unintended consequences as we move forward with policy change.
I think it's interesting. I think that's such an important aspect, because I agree that when it talks to, especially as the country is having, states are moving forward and making marijuana legal, in many cases are decriminalizing use. I think that makes it all the more important because frankly, I understand the arguments for and against whether decriminalization and legalization, whether that's better, but we have to be really, if we're talking about that, we need to make very clear that I don't think anybody thinks that, or very few people would argue that teen smoking crack for fun is good for them. That's something we need to be very clear that even people who are for or sympathetic to decriminalization, we should be all speaking with one voice that abuse of any substance is a bad thing. Jermaine, I was wondering, one other thing that I think is kind of an interesting, and I feel like this is something that the White House has been talking about, is a simple way for something that we can all do is not allow, not be hoarders when it comes to things like pharmaceuticals. That if there are appropriate uses for things like opioids, when you're done with that, you don't hang on to these like they're gold, because once they're no longer serving their function, it's not that they're just it's not, exactly. They're not something. Yeah, they're not something you can just keep in your counter for when you need them on a rainy day. That you need to dispose of them. And can you talk? Because I think there have been talking about the need to dispose that and parents' role in that and health and safe ways to dispose of your pharmaceutical drugs.
I'm really glad that you brought that up, and it's very timely because at the end of October we have the National Take Back Day coming up. And at the mid-year back in April, we had a smaller Take Back Day initiative that took in just under 1 million tons of excess opioids. And so we'd really like to just completely bust through that record coming up in October, because who thinks about the excess drugs that you have in your medicine cabinet? And yet, both Jessica and I've met parents who the heartbreak of having a child who decided to experiment with something that was right there in the house and then becomes addicted to it. It's just, that kind of heartbreak is unimaginable and very easily addressed by just, when you're done, take the opioids as your doctor directed and then get rid of them, get them out of your house. It might not even be your own child. We also have heard stories of people trolling through open houses in real estate to go through people's medicine cabinets. Unreal, but these are the lengths that people will go to. So the responsible thing is to be aware when you have opioids. Going to the whole information underload thing. I had Percocet left over after a surgery like 10 years ago, and it wasn't until I was in this job that I knew that Percocet was something you should get rid of when you were done using it. So these are the kinds of things that we need to all become educated on. Thank you for bringing that up.
Yeah, and it's something I think that it's because I think that I actually feel as that it's hard to know. We all say like, oh, we need to get involved, we need to do something, and it's like, what can we do? Because it's that it is hard to know where to start, and I feel like this is something that could really be easily changed. Everyone can do this, and everybody can help raise awareness. I feel like that's a really positive first step that we can all take. So there's another question.
So both of you touched a little bit on the Senate bill that is likely to pass this week on the big opioid package. I was wondering if you could talk a little bit more about that. I know that there are a lot of differences between the House bill. Are there any big provisions that are important to kind of really addressing this epidemic that are in one versus the other? Or if you could just talk a little bit more about that bill.
Do you mind introducing yourself?
Oh, sorry, I'm Sandia from CQ Roll Call.
So there's a lot of similarities between the House and the Senate package. Both bills treat addiction like the disease it is, with a healthcare response. There's lots of similar provisions. It does things like clear out telehealth barriers and telepsychiatry, so we can make sure that we address our treatment capacity gaps, particularly in rural America. It streamlines, makes more treatment available, more medication-assisted treatment available. We have 3 medicines available for the treatment of opioid use disorder, and yet we don't use them often enough to make sure there's a healthcare response to opioid use disorder. However, we don't have any medications for methamphetamine use disorder. We don't have any medications for cocaine use disorder. I don't love our medications for alcohol use disorder. Some of the differences, there isn't in the Senate package an IND fix. The IND is the arbitrary 16-bed limit for public funding of inpatient treatment. There's a difference in the 42 CFR changes. Those are in the House bill and not the Senate bill. From a patient advocacy perspective, we recommend caution on changing any of the patient protections and confidentiality protections when it comes to having a substance use disorder. I wish today that we lived in a world where there is not discrimination from having this disease, but we're not there yet. I hope that we are at some point, but this disease, even being in recovery from this disease, can cause problems with losing a job or child custody and divorce proceedings, lots of different things. And so there has been some discrepancy on how they tackle that. There's $3 billion in new resources in the Senate package. We are particularly supportive of a provision that helps families and patients in crisis. We need to make sure that those that still have an active use disorder or are struggling or have a loved one with an active use disorder have the resources and care that they need. The reauthorization of ONDCP, the reauthorization of NIDA and the DrugFree Communities program is in the Senate version of the bill, along with some increased pieces around child welfare intervention and resources for children impacted by parental substance use disorder. Taken together, if these bills are combined in conference, this is a historic legislative response with new resources and better policies to address substance use disorders as a nation.
I think what's exciting about the package is we talk a lot about the opioid crisis being a nonpartisan problem in search of bipartisan solutions. And we're very optimistic from what we're hearing about passage and seeing this ultimately get signed. You know, our only concern at this point, well, not only concern, but you know, we always want to get there to the finish line, and particularly with the weather and some of the logistical concerns, just anxious to see it finally get done and be able to celebrate this, as you said, a historic step forward.
Yeah. Isn't there a particular provision also that's aimed at trying to prevent some of the worst fentanyl coming in from overseas? Because I know that's a really important factor. Yes.
Thanks. Hi, I'm Megan Vasquez and I work for CNN. My question's for Charmaine. Actually it's a two-sided question. One, could you tell me a little bit more about what Recovery Month is going to look like for ONDCP? And two, there's been some reporting about a formal or informal marijuana policy committee within ONDCP, and them sort of being the liaison for a bunch of different agencies to gather to talk about marijuana policy. I was wondering if you could tell me a little bit more about that, and if that exists, and what conversations you all are having.
Okay, two big questions. For Recovery Month, we've already seen, we kicked off right at the beginning of the month, the President issued a proclamation establishing Recovery Month, and talking about the importance of encouraging the work that's being done at the grassroots level with encouraging people in recovery. SAMHSA over at HHS had a recovery luncheon, bringing in grassroots people. And I know Jessica was there, you know, just bringing people together to talk about recovery. Deputy Director Carroll is participating in the Recovery Walk in Philadelphia coming up next Saturday. I could go on. It's exciting. There's a lot of things going on to emphasize recovery. I think it's, you know, people talk a lot about some of the other elements involved in recovery or in this crisis, and so I'm glad to have a full month to really kind of focus on some of the tremendous work that's being done. And that really kind of sets us up for moving into October, where we're going to be, there'll be a prevention month and a whole host of activities around that. I did see the reporting around the marijuana issue, and what I would just underscore is that, as I said in our talk, the role of ONDCP is twofold. One, the Deputy Director's job is to be the President's drug policy advisor, and then organizationally our role is to play a coordinating function across policy development. And so as we look at marijuana, that's always been part of our mission. What we are doing administration-wide is our job for the President, which is to look at the policy issues and to consider what the research looks like.
like and to be pulling the data together and doing our job for the president in that way.
Thank you. Yes, we have time for one more question.
Hi, I'm Mireille from the Charles Koch Institute. Aside from government, I'm curious, what are some of the partners that you all are currently working with or looking forward to working with to really amplify this issue?
I assume that's for me, but
Sure.
why don't you take that?
So we are really excited about our partnerships within the healthcare field. A major focus needs to be the integration of the treatment of this into our healthcare system for a healthcare response. So we launched an emergency medicine initiative with Yale Medical School and the American College of Emergency Physicians. We plan to go subspecialty by subspecialty to build the resources and the training that every sort of cohort of physicians need to prevent early intervention, screening and detection and treatment of substance use disorders. We have 200 hospitals that are already enrolled in our collaborative with Yale and ASEP, and are really excited. We chose emergency medicine as the first area to partner with physicians there because I firmly believe that one, we have not partnered with or empowered our physician community enough to give them the tools they need to treat this illness. We can crucify them a little bit about not treating it or even causing it, which is not the right way to talk about culture change and building our capacity. So we're super excited, and also the opportunity to intervene after a non-fatal overdose. 70% of those that we lose every day to an overdose, and right now we're losing 200 people a day. That's like an airplane crash every day. 70% of them had a previous non-fatal overdose. So if we better equip our emergency departments, our EMS, our first responders, with the protocols and the training and the tools that they need, to use that as an opportunity to engage that patient in the treatment and the follow-up care that they need, we can, in the best way possible, start to bend the curve on the number of people we're losing because we're providing the triage care to the folks that need help the most.
Charmaine, I think that's really an important part of this because I love hearing about what the leadership at the government level and talking about the bully pulpit and using things and how they coordinate response. But I do think that this is really the solution to this again is in private individuals, but then also organizations and businesses and schools. I was talking to Tara earlier about the work that they're doing in trying to reach high schools and middle schools and get some of the information out. Those partnerships, I think there's a growing number of companies, drug makers and other technology companies that are trying to figure out ways that they can encourage safe use and prevent drug addiction and drug abuse, as well as disseminating some of this information. So I think that this is one of those things that when you look around and think about what is good about America, and the kind of the civil society and the kind of the grassroots recognition that we all have a role to play, that the government clearly can't. This isn't a policy issue where you can just snap your fingers and charge this. We need every kind of all aspects of society working to try to curb this crisis. So we're going to close out there. I hope some of you can stay around and have more of a conversation. I want to thank everybody in this room for coming today on this important issue, but most especially our panelists, Charmaine and Jessica. Thank you so much for coming.